this, we definitely need something inside so strong. Huh? Let me share.
Joy 99.7 FM. Joy 99.7 FM.
The higher you build your barriers, the taller I become. The farther you take my
Afternoon on Joy 99.7 FM. It is Ultimate Health, your ultimate guide to healthy living with me, Nortey by nature. Last week we started the journey trying to unpack, break down, dissect hepatitis.
brothers and sisters,
I'm glad to say we've got in the studio
it's not good enough.
Dr. Fatima Mohammed.
When we know better,
Gastroenterology fellow in training. She's at the Kolibu Teaching Hospital. Normally she's in Tamale. She's with us today and I'm glad to have her in the studio. Doc, how's it?
I'm good. How are you?
Charlie, it's been a painful week.
Tough week, yeah.
A tough week for the whole country.
Sorry.
Just bend the mic closer to you, yeah? Good to see you. Looking radiant as I recall.
Thank you.
Last week I got so many messages from people, status police, peeping at me. They said, your guest is so elegant and poised. Do you hear that often?
Yes, thank you.
You hear that?
Thank you to your viewers.
They said, Chale, her outfit, the way she's sitting, man. And she's a doctor, and she's still baking herself. But we're grateful you're able to join us today.
Thank you.
Right. Last week we learned what hepatitis was, inflammation of the liver.
Yeah.
Right. You took us through various causes, viral, toxic, and many others.
Yeah.
And then we looked at the different types,
Yeah.
their, shall I say, characteristic modes of transmission. And then we got to the fact that apart from the surface antigen, is it antigen? Yeah.
Yeah.
Test for hepatitis to understand which type and how serious it is, whether it's acute or chronic, we need more advanced tests
Yeah.
to be done.
Accurate.
Okay, have I done well?
Yeah.
Yeah. Is there anything that you want to highlight from last week?
Yeah. So basically, what you said, we looked at the types of hepatitis or the causes. Let me
Causes,
say yes.
Right.
And amongst the causes, we said that the viral causes were the most prevalent in our settings.
Okay.
And that led to a lot of the complications from hepatitis that we see. Okay, and amongst the viral causes, we also mentioned that hepatitis B, C, and D have a similar mode of transmission,
Okay.
and hepatitis B is a vaccine-preventable disease.
So we have a vaccine for that.
Exactly.
We can prevent that with the
Yeah.
vaccine.
Yeah.
Okay. Right. Okay. So listeners, I mean, you are my discerning listeners. I know despite your pain and grief, you are logged on. And so if there are any things you want to ask to pull back, but we're moving forward because we wanted to understand properly the different tiers of treatment and management.
Yep.
Okay, and so that's the important focus for today. We're looking at treatment and management. Of course, we will accommodate, latecomers who will take us back to what hepatitis is, but we're moving forward.
Yeah.
So, Doc, if and when hepatitis is identified and diagnosed,
Yeah.
right? Can we just hit on the conclusive diagnosis?
Yes.
Right? What are you doing? Is it a blood test? Is it a stool test? And how do we get to the conclusion and what happens after that?
Okay. So to take us back a bit, last week we mentioned that the symptoms don't usually show. So most people are asymptomatic. They don't show any symptoms.
Right.
And they get diagnosed often when they come for different reasons.
Okay.
And or when they have complications, which we are trying to avoid. And so we recommend that whether you have symptoms or not, and the symptoms could be fever, yellowing of your eyes, some abdominal pain, or anything unusual, you should get checked for hepatitis B and C.
Okay. You mentioned
And-
dark urine as well.
Yes, dark urine.
Okay.
And let it be part of your annual health checkup.
Okay.
Especially for those who are not vaccinated against hepatitis B,
Right.
would recommend that you go get the vaccine. But for the diagnosis bit, so for hepatitis B, you need to get a blood test first of all, and we usually start with a screening.
Okay.
Okay, so the screening is to detect the hepatitis B surface antigen.
Okay.
As we mentioned last week, when the virus enters your body, it leaves some particles or footprints. Yes, and we use that to diagnose.
Okay.
So hepatitis B surface antigen, if it's found, is an indication that you've been exposed to the virus.
Okay.
It indicates a current infection.
Okay. We mentioned last week that we're in a highly endemic
Yes.
part of the world.
Exactly.
Right. So being identified as having been exposed to the hepatitis virus, is that bad news? If it's all around me, is it so strange or serious if I'm identified as having been exposed?
Okay. So I wouldn't say it's bad news, but it's always good to know
All right.
that you've been exposed.
It's significant medical.
It's significant. So once you have the surface antigen, we go further to the next level,
Okay.
of diagnosis.
Right.
which is the hepatitis B profile.
Mm-hmm.
And the profile further looks at other footprints, okay, that the virus would leave due to your immune system trying to combat the virus. And it's this profile that will let us know whether you've been able to clear the infection, whether the infection is the virus is actively multiplying in your body, or maybe you had the infection but you've been able to clear it. Yes.
Okay. So
yeah.
There was some concern last week about those who may or actually have tested negative, right? Does that mean there's no need to follow up anymore?
Yes. So a very small percentage of people, as I mentioned, do have what we call occult hepatitis B. So the surface antigen, which is the routine screening test we do, may not be positive. But then when you go ahead and do the profile, you notice that one of the parameters which indicates that the virus is integrated into your DNA, that's the core antibody, would be positive. And that indicates that you actually do have the virus, even though the surface antigen is absent. So would recommend, the surface antigen is used because it's cheaper.
Right.
Yes, and it's easier to do. It's a rapid diagnostic test. And so you can do it on spot. But if you have to do 90% of the population, yes.
Now at
90% of the population, yes.
Now at this level for Ghana, are we offering, because last week we did talk about newborn testing and all that, are we offering any free hepatitis testing anywhere?
Unfortunately not.
We're not.
And so, that's the reason why we are here. So the Ghana Association for the Study of Liver and Digestive Disorders, called GASLID, is a group of gastroenterologists, physicians, general practitioners, hepatobiliary surgeons, radiologists, and oncologists who look at liver cancer, coming together to form that association. And as part of our advocacy, we are trying to appeal, to all stakeholders to make the screening at least be free. And in that way, we can pick up the infection early and manage it. Some countries have been able to do that, and they've been able to eradicate hepatitis B. And yes.
So we're also pushing, is it covered by the National Health Insurance Scheme?
The surface antigen is. Yes. But the profile, you'd have to pay for it.
Folks, 18 minutes past the hour of 2 on Joy 99.7 FM. My name is Nortey by nature. I'm in the studio with Dr. Fatima Mohammed. Yeah, she's a gastroenterology fellow in training, right? She deals with all inside stuff, but liver and what else?
And digestive disorders.
We're looking at hepatitis, very common in our parts, in our rural parts and up north especially. It's quite highly prevalent. And the complications are serious and let me say even extreme, right? So you should know your status, and you should check. There are various types which are transmitted differently, right? But we've looked at signs, symptoms, causes, and we're now focusing on the treatment. We're just tidying up a bit on the conclusive diagnosis and the test required. Many people stop at the surface and don't go any further, and there may be serious things going on with your liver. All right? 19 minutes past the hour of 2. Let me read a couple of messages. I see somebody rightly calls me Nortey by nature. I'm not naughty by nature. Thanks for the opening song. This is from Annette Sepelite, connecting from Pram as always. God bless you. God bless you too, Annette. This one says, hello Nortey. I want to know whether whether the hepatitis test, if taken and you're negative, is it a one-off vaccination or test, or should it be done every year? This is from Ifwa. All right, we'll pick that up for you, Ifwa. Thanks for sharing. Yes, I think I've cleared. No, hang on. All right, these are earlier messages. So, right, is it one-off? Once you're done, or should you be checking all the time?
Yes, so for the screening test, if you are not vaccinated, and you don't have evidence that the vaccine has worked, so what we are now advocating for is that even after you take the vaccine, which
Okay.
is 3 doses. So
Right.
you take the first dose, the second dose is after a month, 4 weeks, and then the third dose has to be within 6 months.
Okay.
So,
3 doses spread across
Yes, a period
a
of,
period of
at
time.
least, yes.
When you
6
say
months.
dose, sometimes, so people are thinking, am I taking tablets? Is it an
No,
injection?
it's a shot.
It's a
yeah,
shot.
Yeah.
Okay, right. 3 shots.
3 shots.
All right.
So once you're done, we advocate that you go and check what we call your antibody levels.
Okay.
To make sure that the vaccine has worked. For a number of reasons, your vaccine may not have worked, and you'd be walking around thinking you've been vaccinated. Sometimes, how the vaccines are transported and our power outages, it breaks what we call the cold chain.
All right.
And affects the efficacy of the vaccines.
Okay.
So you'd have to check, and if your antibody levels are 10 and above, then you are safe.
Okay.
And you don't need to keep repeating the test because it is protective in over 95%,
Okay.
of cases.
Right. As soon as we're talking about antibodies, then
Yeah.
your body's response
Yeah.
has sent out these antibodies
Yeah.
that protect you.
Yes, these
Okay.
soldiers. So
These
whenever
soldiers,
you
right.
encounter the virus, because you already have soldiers armed waiting, they kick out the virus before it enters into your
Okay.
system. Yeah,
And the vaccine, of course, is
Yeah.
triggering this response.
exactly.
Okay, so you're saying that it is important, imperative that you check
Yeah,
that this response has actually taken place and also generated or released a significant or sufficient
level.
number
Yeah,
of
of antibodies.
antibodies.
Exactly.
Okay, and this
Yeah.
can be checked with a
Yes.
test
Yes.
to look at the level
Yes.
of the antibody
Yeah.
response.
The
Okay,
response.
folks, we're getting detailed, but that's why you are on Joy 99.7 FM and nowhere else. I'm speaking to Dr. Fatima Mohammed. We're still breaking down hepatitis, all right? And today we're zooming in, focusing on treatment and management. Okay, those are very important words. I know sometimes we love, we wish, we pray for cure.
Yeah.
She is qualified to tell us whether we're talking about cure or rather treatment and management.
Yeah.
Okay, phone line 0302 216541. WhatsApp is 055 11 11 997. This is Ultimate Health
99.7 FM.
on Joy 99.7 FM. If you have questions, you can send them by WhatsApp 055 11 11 997. We're live on Facebook, YouTube, and X, and Ziggy will, push your questions and comments and maybe even confessions through to us. Okay.
Yeah.
So we talked about complications. So it's
Yeah.
important that you've gone through this rigorous, should I say,
Yeah.
flow of investigation
Exactly.
to ascertain where you are.
Yes. So after the profile, if you are found to have the chronic infection, okay, so sometimes it's acute. So we give it time to see if your body can clear it. I mentioned that for hepatitis B, a lot more people are exposed.
Right.
And for the numbers that are exposed, over 90% are able to clear the virus, naturally without any intervention.
All right.
And it's only the 5 to 10% that carry the virus and have chronic, viral status. So
Okay. Can I just get you to clear up on this clear the virus business? When you say you've cleared the virus, I mean, what's that? What does it mean?
So it means that when the virus entered your body, the antibodies or the soldiers that your body formed,
Yeah.
to combat the virus, they were able to completely eliminate the virus from your system before it went into your DNA. Because
Right.
once it gets there, it's practically impossible to get it out.
Okay.
Yes. And when this happens, those soldiers stay.
All right.
So anytime you are exposed to the virus, they fight it.
So that would be natural
That's
immunity.
natural immunity. The
Not-
same
not
as when you
triggered by
get
a
the vaccine.
right?
Exactly.
But this is your body doing its job.
Yes.
Right. And
But-
therefore you've cleared it.
Exactly.
Okay.
But because we cannot predict who would be able to clear the infection and who would not, we advocate that everybody gets the vaccine.
Okay.
Because in the unfortunate case where your body does not or is not able to clear the infection, then you become a chronic hepatitis B person, or you
right.
inhabit the virus and it's difficult to eliminate.
Okay.
Yes.
Right. In that state where you are a carrier or chronic carrier.
Yes.
Right?
Yeah.
Therefore, you have chronic hepatitis.
Yeah.
Right. You are still able to transmit this to others?
Yes, so that's the danger because it doesn't come with any symptoms often. People just transmit the virus unknowingly because if you know you have it, I'm sure you take the precautions. But
Right.
people do not know they have it, and so they transmit the virus. So from mother to child, sexual partners, sharing sharp objects like I mentioned, blood and blood products, tattooing and using body piercings and all that.
Okay.
And so when we detect that you have the chronic hepatitis B, there are two forms. So you either have the active infection where the virus is actively replicating or multiplying.
Okay.
And with that one, because the viral load can go up to tens of millions, yes, in your body, it directly affects the liver and can progress very quickly to the complications.
Right.
So even though the complications would take at least 10 years, for some people in as less as like a year or two,
it can be very aggressive.
Yes, they begin to, because the viral load, is so much.
Okay.
And because you don't know, it ends up affecting the liver and leading to liver cirrhosis or liver cancer.
Okay.
Yeah.
Serious outcomes, folks. That's what we're talking about. Hepatitis, its types, its causes, symptoms, complications, treatment, and prevention. Right? We must make a point to stick in prevention there. But doc, so sexual transmission, right? Is it for all the types?
Yes. So more for hepatitis B than C,
Right.
even though both types can be transmitted sexually, but it's more common with hepatitis B than hepatitis C.
Okay. And when we say that, are we talking about intercourse?
Yes, so sexual intercourse
Right.
without protection.
Without protection.
Yes, so the same manner in which HIV virus is transmitted, hepatitis B and C can equally be transmitted in that way. Yeah.
All right. Okay, good. So we've understood that, and we've talked about chronic and active forms.
Yeah.
Right. We've covered that the fact that there are various degrees of complications, right? But we are essentially still talking about inflammation of the liver.
Inflammation.
So when it gets serious, is it just the inflammation, or it's gone beyond that?
So for those whose viruses are not actively replicating, okay, the profile will be able to tell us that. We do further tests. Okay, so after we do the profile, if we find out you have a chronic infection, we first of all request for the viral DNA.
Okay.
The quantity. I mentioned that some can go as much as tens of millions.
Right.
Yes, so we can have anything between 10 viral particles to hundreds of millions of viral particles in an individual. Yes.
Whoa. Okay.
And so depending on the level of the viral DNA,
Right.
we decide to treat or we monitor you. So if it's very low, we may decide to monitor you to see how your body handles it. But if it's high from the onset, we immediately put you on treatment.
Okay.
Yes.
Now, when you tell me, or when you tell a patient that they are being monitored or under some form of observation, what really does that entail? What are you doing? Are you saying come back in 4 weeks, 6 months?
Okay.
And what are the required precautions that this person must take?
Has to take. Okay. So beyond the viral DNA, we also do a liver function test.
Okay.
So it's a blood test that tells us how your liver is, the state of your liver, whether there's inflammation or you just have the virus but there's no inflammation.
Okay.
If you have the virus and there is no inflammation and the viral load is also low, we monitor you every 3 to 6 months with tests, repeat of the test. So every 3 to 6 months, you'll be required to do the viral DNA level for us to know whether the virus is multiplying now, and also do the liver function test. And both are blood tests to determine whether there has been an onset of inflammation in the liver or not.
So actually doing a state of the liver monitoring.
Yes. We also check what we call the alpha fetoprotein. That's to detect, it's a biochemical test that detects whether cancer has started in your liver.
Right.
Yes. So it can detect very early stages of liver cancer. So every 3 to 6 months we do that, because I mentioned that somebody can have a very low viral load and still have the cancer, because the virus integrates its DNA into your DNA and changes a lot of things in your liver cells. And so the fact that you have low viral load doesn't mean that don't come back for review.
Okay.
Yes.
Doc, in this state,
Yeah.
if I can call it that, right? I'm under monitoring.
Yeah.
I may have low viral load, but you want to check me every now and then, right? Would I have any visible or visibly manifest signs and symptoms? Would I have jaundiced or yellowish eyes, or this and that, dark urine? Would I have any of those?
So if you have the chronic infection and you begin to have the jaundice, the fever, and it means that there is hepatitis now. It means that the virus is not just sitting there quietly.
Okay.
It started to cause an immune response, which leads to inflammation of the liver.
Right.
And in that case, you qualify for treatment immediately.
Right.
Yes.
Okay. What about, we hear sometimes that people actually experience weight loss.
Yeah.
And sometimes bloating of the abdomen. Should I be saying abdomen or stomach?
Abdomen.
Abdomen is
accurate.
correct.
Yeah.
Right. Okay. People who have bloating of the abdomen, and then sometimes we see weight loss. Let me just quickly take a call. I'm told I have a caller on the
That's
line.
fine.
Okay. Hello. Good afternoon.
Hello, good afternoon.
Yes, sir. Who am I speaking to?
Yeah, Abu Muhammad from Japan.
Abu Mohammed from Japan.
Yes, sir.
Right. You're welcome to Ultimate Health. Share with us.
Thank you very much.
Right.
Yeah, I want to find out, is there a blood group that is vulnerable to hepatitis?
Is there a blood group that is vulnerable to hepatitis?
Yes, sir.
Okay.
And also, is it true that a food made of meat is not always good for people with O positive? And also, is it also a fact that it is cow meat that is good for people with blood group of O positive?
Oh, Mohammed from Japan. Now he's taking us into blood groups and so on. All right. So the first one, right? He was asking about foods. He asked about maize, right? He's saying, is it good for people with blood group? Are there people with a particular blood group that are more prone to hepatitis? And then he's also adding that cow meat is, I guess, presumed to be good for people of a particular blood group.
Okay.
Yeah.
So let me take the first question.
Right. Blood group and hepatitis.
Yes. So there's no particular blood group that is more susceptible to hepatitis than another.
Okay.
However, I must say that some people with sickle cell disease
Right.
May need more transfusions than everybody else.
Okay.
Because of their
So they have a tougher, rougher ride.
exactly.
Okay.
So because of the repeated blood transfusions, they are constantly exposed to blood-borne viruses.
Okay.
Not just hepatitis B, but C and then
Right.
HIV.
So they're more
Yes.
vulnerable.
Yes. So apart from this group, we don't have any differences between the blood
And your
groups and how you acquire.
sickling status is different from your blood group.
Yes, it's
Right.
different.
Let's be clear.
It's
Right.
different.
Yeah.
Yeah.
Okay.
Second thing about the maize, yes. So we have something that grow on maize
Right.
called aflatoxins.
Right.
It's a type of mold, okay? And particularly in our setting, the way we store our maize and jute bags makes it very conducive for mold to grow on it.
Okay.
Okay, so we use it for our mole and our different types of foods, and the molds that grow on it, that particular type, the aflatoxin, has been shown to cause hepatitis.
Right.
And can lead to some of the complications that we are talking about.
Okay.
Can lead to liver cirrhosis and liver cancer.
Right, Doc.
Yeah.
I'm very, 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 should I say, curious about
Yeah.
your choice of words. Doctors don't just speak anyhow.
Yeah.
You said it has been known to cause.
Yeah.
You didn't even say correlation.
Yeah.
So that's a direct empirical link
A direct cause.
between this type of fungus,
Yes.
the aflatoxin,
Aflatoxins
and
liver
liver cancer
cancer and cirrhosis. Because it causes hepatitis.
Okay, right. Emphatically said by my guest,
Yeah.
Dr. Fatima Mohammed. We're looking at hepatitis. We're not doing blood groups. I know you guys go gaga when you hear groups, right? But we're talking about hepatitis complications, treatments, and we're getting very focused this week. Phone line 030 6541. WhatsApp is 055 11 11 997. We're live on Facebook and YouTube. This is from Habi in Bolga. Hello, Nortey. Please, I tested in 2008 and I was diagnosed with chronic Hep B. I've done profiling and viral load over the years, but I was told it is not infectious. The viral load values have remained below 600 over the years. Any comment from the doctor?
Yes. So I'm glad she's asking this question, because that's the challenge we face. Okay, most people will not have very high viral loads, and in addition to that, their liver function test I mentioned may not show hepatitis. And so most of the health practitioners will tell them, oh, your viral load is low, and so you are free to go. That's a mistake. That's wrong.
Right.
The reason is because we cannot predict how the virus will respond at any point in time. So that's why we advocate that even though your viral load is low and you have a lower risk of progressing to the complications, you don't just stay off review. You need to follow up.
So Habi is somebody who's going for
yes,
review.
You need to go for routine reviews every 3 to 6 months. Have your viral load checked, your liver function test, and your alpha fetoprotein.
Right.
Because there are patients that came in with slightly high alpha fetoprotein over years of monitoring, and then we proceed to do a scan, ultrasound scan, and then we see a small, mass in the liver, indicating that there's a small growth, cancer. And when it's picked up, even for the liver cancer, when it's picked up early, the outcome is very good. So the hepatobiliary surgeons may be able to remove it, do a surgery and remove that part from your liver, just because you were monitoring it.
And therefore there was early detection.
Otherwise, when it grows beyond a certain stage and it starts to invade your blood vessels and all that, unfortunately there's nothing that can be done.
37 minutes past the hour of 2 on Joy 99.7 FM. The program is Ultimate Health, your ultimate guide to healthy living. This and every Sunday, 2:05, we come alive. My name is Nortey by nature. I'm with Fatima by nature. Dr. Fatima Mohammed, gastroenterology fellow in training. And we're going through the basics, and we've gone beyond basics now. We're getting very, very serious and maybe even specialized. But this one says hepatitis B. Doctor mentioned about 95% of people could clear the virus potentially via their own immune system. She also mentioned that if you have your 3 shots, it's imperative you check your antibody level, right? 10 and above means you're covered. You've been listening, right? Is it possible to also check the antibody level of people who have never vaccinated, right, but have in a way been exposed and cleared the virus in their system, so the natural immunity you talked about? If so, why don't we check the levels of people before they get vaccinated? Right? Is it a prerequisite for vaccination that we know and we've checked your viral load, the antibody load, sorry? Will that immunity also last for 10 years, just as in the case of those who get vaccinated? Kojo Inaku said, Charlie, buy yourself a beer or something you like.
This is a very intelligent
very
question.
Detailed. He's followed the discussion.
That means he's been following.
Right.
So yes, ideally, as I mentioned, a lot more people have been exposed to the virus. And so you could go and check your antibody levels. The reason we advocate for just testing for the surface antigen and vaccinating is because that's the cheaper route. And it's going to be more accessible to a lot more people than going to check the antibody titer levels,
so money
which can be a little bit expensive,
financial.
And so the more feasible thing to do is to advocate for people to check, do the screening, and then if you are negative, you go get vaccinated.
Okay, great stuff. 40 minutes past the hour of 2. Did we speak about the cow meat? We spoke about the maize.
So the cow meat thing, apart from the viral causes, There are some lifestyle things that can predispose us to hepatitis.
Okay.
We call it fatty liver disease.
Right.
Okay, so
Fatty liver
yes,
disease.
you may not have viral hepatitis or any of the causes I mentioned, but if your lifestyle, you take a lot more fatty foods, you don't exercise, you live a sedentary lifestyle, you may be exposed to what we call the fatty liver disease.
Okay.
And that can also lead to hepatitis and
Right.
liver cancer.
Whoa.
Yes,
Lifestyle.
so red meat is one of the culprits. We are not saying don't eat it at all, but eat it in moderation. We advocate for more vegetables and exercise. Yes.
What do you
To be
mean by
incorporated
wait, I mean,
into your lifestyle.
Doc,
Yeah.
you know, red meat, red,
Yeah.
cocoa,
Yeah.
nam cocoa. What does it really mean when a medic or a physician says red meat?
Red meat is like the cow meat because that's the muscle, you
Okay.
know, that we eat mostly. So cow meat, goat meat.
Right.
Yes. The other type is poultry, which is healthier than
Right.
Than red
but
meat.
also classified as
Yes.
red meat.
poultry is not
It's not red
classified.
meat.
It's not
Okay.
red meat.
Right.
Yes. And then so we advocate that if you eat red meat, it should be once a week for a serving, a portion of red meat once a week. Poultry can be eaten 3 times a week.
Okay.
Yes, in moderation.
Right.
And then you also have to incorporate lots of vegetables.
Mm.
Yes,
Okay.
into your diet, and then more whole grains, exercise, and just keep moving.
All right.
Yes.
So listening to you and looking at you,
Mm-hmm.
that definitely is lifestyle, and therefore you're talking prevention here,
Yeah.
right? There are things you
Prevention.
can do, right,
Mm-hmm.
that keep you from harm's way, where harm is hepatitis.
Yeah.
Right. Eat well.
Yep.
Right. Vegetables. I tend to notice in East Africa they love vegetables. Right. Everything is vegetables.
Yep.
And
Exactly.
we like oil, and we don't like the vegetables unless we've crucified and pulverized them.
Yeah.
Right. But this is a preventive measure you're talking
It's a
about.
preventive
Exercise
measure.
as well.
Yep.
Okay. Right. So, yes, that was the gentleman who had that detailed question for
yes.
us. So we
Yes.
could test these people.
Yes.
All right, potentially, but
Yeah.
we'll be going to be spending a lot of money,
Yes.
right?
But
which
if you
people
can
don't have.
afford, absolutely, you can
Right.
go and get it checked.
Okay.
Additionally, I must mention that some countries have a test and treat approach.
Hmm.
So rather than in
As
our
a
certain,
policy.
yes, a policy,
Right.
and that has really helped them curb hepatitis B infection. So rather than in our setting where we say we are monitoring to see if you have low viral loads, we are monitoring to see whether your viral load will increase or whether there's inflammation of the liver or onset of complications before we treat. Some countries, once you have the chronic infection or at any detectable level of viral load, you start the
To
treatment.
give you treatment.
Yes.
Okay.
And the reason for our, route, which is WHO approved as well, is because the treatment is basically a long-term treatment.
Right.
And it's not cheap. It's not covered by health insurance.
Okay.
So we don't want to start treatment for a person with very low viral loads, and then, a year or 2 down the line, the person can no longer afford the treatment
Okay.
and stops. What happens is that the virus becomes very smart, and then there's resistance.
Okay.
So the virus tries to find ways to dodge the medication, so that next time when you use it, it really doesn't work.
Wow.
Yes. And so if we are going to start you on treatment, you have to make a commitment, a personal commitment that you'd follow through with the treatment over the long term. So we always tell our patients that it's a long term, treatment that you are going to
Okay.
undertake, and you should be committed to staying on
Right.
on course. Yes.
Okay. Committed.
Yeah.
Also, commit your wallet, right? Doc, I know very often we are very reluctant or reticent to give costs, but can we give a certain ballpark figure that people would understand? For example, if you're
Yeah.
doing the 3 vaccine shots, what are we talking about roughly?
So each shot is about roughly, I would say, about 60 cities.
Okay.
Yes.
Right. And you're doing 3.
3, yes.
Okay.
So if you go to the public health unit of most hospitals,
Right.
you would have that. Yes.
Okay. Right.
You can have it done.
It's available.
It's available.
It's not scarce.
It's not scarce.
All right. You
It's
can
readily
get the
available.
shots.
You can get the shot.
This is for Hep B.
Hepatitis B. Yeah.
Right. Okay. C, there's no vaccine.
Unfortunately, for C, we don't have a vaccine yet.
Okay.
So for hepatitis C, what we are advocating for is test and treat.
Test and
So
treat.
for that one, we have the test and treat approach. And the reason for that is because hepatitis C can be cured, as
Okay.
opposed to
you can
hepatitis B.
treat it conclusively,
Conclusively, emphatically
Right.
to clear the virus.
Okay.
Unlike hepatitis B. So that is why test and treat is a difficult approach for hepatitis B, because it's a
Okay.
long-term,
Right.
treatment. Yeah.
Okie dokie. 46 minutes past year of 2 on Joy 99.7 FM. The program, as always, on a Sunday afternoon. Ultimate Health, your ultimate guide to healthy living. If it impacts on your health and well-being, we'll definitely talk about it. World Hepatitis Day was July 28th, and so I've kidnapped this lovely doctor for 2 weeks now. I'm thinking of ways to extend that, but we're doing serious business. We're not mucking around. We're not messing, right? We're talking about hepatitis, different types, different causes, different modes of transmission, signs, symptoms, complications, treatment, and we've stuck in there at the tail end. You can hear if you are listening. Prevention. Okay, right? 0302 216541. WhatsApp is 055 11 11 997. We're live on Facebook, YouTube, and X. Yes, Doc, you were going to add something.
So for hepatitis B,
Right.
we always tell the patient that you need to come in, and if you meet the criteria in our setting, if it's in other settings, they may decide to treat you regardless of
Okay.
your viral load or whether there's inflammation or not.
Okay.
But particularly if you have a family member who has had hepatitis B and had complications from it,
Right.
regardless of your levels, we have to treat you. So for
Okay.
that colleague of yours whose family member died,
Right.
he is a direct candidate for treatment,
Yes.
whether his viral load is high or not.
Okay.
If you also have other issues like diabetes and other chronic illnesses, we may decide to treat you
Okay.
immediately. If you have any form of lowered immunity from cancer, another form of cancer, or you are taking medications that are likely to lower your immune response,
Okay.
we may decide to treat you.
Okay.
Yes.
So it's not one size fits all.
It's
right?
not a
You're not looking at
one-size-fits-all.
what happened to your friend who had hepatitis.
Exactly.
You must be seen individually, and your case will be assessed on its own
on,
merit.
on an individual basis.
Individual basis,
Yes.
okay.
And the types of treatment response. So most people start the treatment, they come and they start asking doctor, so when am I going to stop? Because naturally they get tired of coming in and having to take the medication. What we are aiming for hepatitis B is viral suppression.
Okay. So
So
you're pushing
if-
those numbers down.
Yes, so if you started off with 10 million, then you come to 10,000, and then below, 1,000, we are
Okay.
happy.
Right.
Yes. And we are happy that we are keeping it there and your liver is not getting inflamed.
Okay.
And
you're being a good boy or girl.
Yes, exactly.
Right.
You're staying away from all the other causes that we mentioned. Alcohol, bad diet and all that.
All right. Great.
And then sometimes some patients may have partial cure. So over a long period, 2 to 3 years time or 4 years, being on the medication, we may decide if their viral load has been undetectable for a very long time, 6 months to a year,
Right.
to take them off their medication and still monitor to see.
Okay.
So for such patients, even off the medication, their viral load remains undetectable.
All right.
But
Partial
we don't.
cure.
Yes, partial cure. But
Well,
we don't
let me-
send you off.
Right.
Yeah.
Let me pause you on the partial cure
All right,
because
sure.
I have somebody on the line and come
That's
back
fine.
for you to conclude that.
That's
Hello. Good afternoon.
Yeah, good afternoon, sir.
Yes, sir. Who am I speaking to?
I'm Jibril.
Jibrin.
Yeah,
Right. Where are you calling from?
Adenta.
Adenta. You're welcome. Share with us.
Oh, no. I had a brother who is affected. I don't know how I can get treatment. And then that, please.
You had a brother who.
Who is affected, yeah.
Right.
He just hopes if I can put it that.
Is he on treatment?
No.
Okay. So what is your request or question? I'm not hearing you too well.
Where, any direction to where?
Okay, where can he get treatment? Okay. Right. Okay. Great. So he says he has a brother who is affected, I presume he's been tested, right, and identified. Where does such a person go?
So when
Or where
you go
should such a person
so when
go?
you go to any hospital at all, talk to your general practitioner.
Okay.
So most of the time they would refer to the gastroenterologist.
Okay.
But we are now trying to advocate for decentralization because of how prevalent the disease is. We don't really have too many gastroenterologists across the nation. So we are advocating that we train the
Can't we just photocopy you?
Yes, we train the general practitioners to be
Right.
able to effectively manage hepatitis B.
Identify, diagnose, and manage.
And only refer when there are issues like complications.
Right.
Yes, that's a more logical
So he can
approach.
go to any
Yes.
public
Any
health
public
facility?
hospital, yes, and tell them he's been tested positive. They
Right.
would go through the profile and the viral DNA,
Okay.
and probably do a liver function test
Okay.
and an ultrasound to find the state of his liver.
So he is
and take
walking
it from there.
into a health facility.
Yeah.
He's not waiting for a specific day for
No.
liver clinic or anything like that.
Yeah.
He presents
He presents.
and gives his history
Mhm.
of having been tested positive for hepatitis.
Yep.
And therefore they can take it up.
Exactly.
And we built the capacity across the
Across
system
the system.
for this to be done.
Exactly.
So at this level, it's not really a specialist you're seeing.
Yeah,
And that should be adequate.
that should be adequate.
Okay.
So
Right.
if the GP finds anything that requires specialist consultation, they would refer as appropriate.
Okay,
Yeah.
great stuff. 51 minutes past the hour of 2 on Joy 99.7 FM. We've got about 9 minutes left, right? And you won't have this doctor again. Though I'm thinking of bringing her next week, because we got to talk about the liver cancer. You know what I mean, All right. But she's here now. We're still talking hepatitis. It's serious stuff. This one says, please, the doctor made mention of the fact that Hep B vaccination requires 3 doses. All right. My first full vaccination was in 2010. In 2024, I tested negative and took 2 doses of the vaccination. So my understanding is that he took a dose in 2010, but he says full. So maybe he took the full 3 in 2010. Okay. In 2024, I tested negative and took 2 doses of the vaccination. The second shot was in June 2024. What happens to the 3rd dose since it has been more than 6 months after I took the second dose? William from Wiaso is confessing.
Okay.
Right. Interesting profile.
Yeah.
So he hasn't completed, right?
Yes.
He had a complete vaccination in 2010, right? Let me presume full cover.
Yeah.
And then he got a negative test in 2024, all right? And then he only took 2. Hang on to that. Let me take another caller. Yep, okay. Hello, good afternoon.
Good afternoon.
Good afternoon, ma'am. Who am I speaking to?
Hello?
Yes, ma'am.
Yes, please. I'd like to ask a question concerning a client I have, please. It's a cousin. He was diagnosed of hepatitis, positive, fine. But then, and was put on liver protector or something, and was asked to do this profile thing. But I'm sure because of the cost, she didn't go to do it.
Okay.
Then I directed her to the hospital. When she went, they did abdominal scan, and they said she has a lot of fluid in the chest, pleural and visceral fluid.
She has a what?
And then intra-abdomen fluid.
She has fluid in the, right, okay.
In the chest.
In the chest.
And then the abdomen. So it was so much that 2,000 plus. They had to admit her and then collect the fluid from the chest.
Is there a question?
Yes, after that, and she was put on what anti-tuberculosis medication, so they didn't see anything like the TB. And it's still coming. I am worried. I don't know if the liver could be contributing to this fluid that is collecting there. But for now, they are focusing on the fluid in the chest.
Okay.
The abdomen one, they are not working on it.
Okay.
I am.
Is this person,
Madam,
Madam, please, let's help everybody. right? So I've gotten the history. So is this person on treatment currently? You say they are evacuating fluid from their chest.
Yes.
All right. So what's the situation and what is your concern now?
My concern is, since the doctor mentioned there could be abdominal bloating and those things, though the abdomen is not bloated, they said there's fluid collection in the abdomen. But for now, they are focusing on the chest.
We've heard that. I'm trying to get your question so that I can put it to the doctor. What is your question?
The liver could be contributing to the fluid that is collecting in the abdomen.
All right. But she is seeing a doctor.
Yes.
And they haven't mentioned liver?
No, they said they are dealing with the chest for now.
Okay. All right. Great stuff. Right. So a long story. Somebody was identified, tested, and then put on liver protection, some kind of medication. But over the time, it has worsened. She's, should I say, accumulating fluids, and they are evacuating fluids. And she's asking, can the liver contribute to this picture?
Yeah. Absolutely. So what I'm suspecting here is that the patient may have progressed to liver cirrhosis. Yes. And by that, the patient may have a bloated abdomen, like she mentioned. And the liver is responsible for producing proteins, okay, particularly albumin.
Right.
And so when you don't have albumin in your bloodstream, you can seep fluid through a lot of spaces, including your chest, your abdomen, into your feet and all that. So the problem here is that when somebody tests positive for hepatitis B, yes, you may put them on all the supplements, but don't forget to monitor, follow them up with their viral load before they get to the complication stage.
Right. Doc, there are a lot of liver supplements and so many things. I don't want to mention the brand names. And people are taking these things thinking they are treating something.
Yeah.
A supplement, is it a treatment?
It's not a treatment. It just
hit that one hard for me.
Yes, it's not a treatment. And there's no evidence to suggest that it treats any of the viral hepatitis that we mentioned. What some of them do is that it just supports, during the inflammation process. Some of them have antioxidants that reduces, the effects of the inflammation on the liver. But it does not replace treatment.
A supplement is not a cure.
It doesn't replace treatment. Yes.
Okay.
And so we must take note of that. Let me just quickly mention that for hepatitis C, because there is a definite cure, we have what we call the sustained virological response. Okay. So after 3 months, 12 weeks of therapy, over 95% of people would be cured. Okay. And the remaining 5%, we may switch to a different regimen to try and cure it. There's what we've launched in Ghana, a Stop Hepatitis C project. Being partly funded by the Egyptian government. And so the medication is free for hepatitis C.
For C?
Yes. It used to be very expensive, even way more expensive than hepatitis B. But the Egyptian government was able to support us because they've piloted that thing in their country, and they've been able to successfully almost eradicate hepatitis C. And so they are supporting us with the treatment. We have treatment sites across the country, from Northern region, Upper East, Upper West. In Greater Accra, Ridge Hospital, Kolebu Teaching Hospital, Cape Coast Teaching Hospital, Ho. It's spread across. So please talk to your GP. Let them refer you to a treatment site. If you do have hepatitis C, yes. For the medications. Yeah.
Sorry to cause trouble. Can you have more than one of the hep in one person?
Yes. So for those,
B and C?
yes, if you have B and C, you definitely have to be treated for the C, but then you also have to be treated for B, because that can accelerate, your risk of the complications.
Right. Let me just quickly go back to the caller who took a full course of the vaccine. Right, and then in 2024 has taken only 2 shots.
Yes. So once you've had a full, vaccination, that means you took the 3 doses. Please go and check your antibody titer levels. You may still have, full immunity, and probably did not need another vaccination. So that's why we are advocating that if you've had the full vaccination, check your antibody levels.
Okay.
Yes, but if you've never been vaccinated and you took only 2 shots and you missed it for more than 6 months, you need to start the process all over again.
Okay.
Yes.
We're at 3:00, but let me just add or ask this. So this person took all 3 doses,
Yeah.
right? Initially, let me scroll down.
In
Where's my-
2010.
2010.
Yeah.
Okay. Right? So let's assume we even got 10 years cover. In 2024, this person tests and yes, they are negative,
Yeah.
but proceeds to take
Another shot.
the vaccination again.
Yeah.
Is there a reason why they may have been asked, or I'm just asking, is it regular?
Yes, so if you've had the full vaccination, we
Right.
recommend that you do your antibody levels before you have another one.
Okay.
Yes, it's only when you do not have sufficient
Okay.
immunity
All right.
that we recommend that you take another one.
Okay. So it could be that they
It
didn't have
could be that.
sufficient.
It could be that.
Right.
Yes.
Okay.
So let me just mention that even though 28th of July every year is World Hepatitis Day, this year Mega Life Sciences supported Gaslit to screen. Their target was about 30,000 Ghanaians.
Whoa.
Yes. And so next year we are appealing to stakeholders. We would want to make it a week-long activity so that we
Right.
can screen a lot more people and then get them tested and treated.
Okay.
Yeah.
I'm even embarrassed that we have to ask for stakeholders, but
Yeah.
people are sponsoring all kinds of things. But this is a very, very important
Exactly.
cause. So I would pray that sponsors, Ziggy and I will collect the money, and then we'll partner with Dr. Fatima Mohammed and Gaslid to make sure it gets to the right and appropriate end users, and we save lives.
Yeah.
So there are still many complications, and that's why I'm looking at you. So
Yeah.
it's not that I want to date you again
Yeah.
next Sunday,
Next
but we have done liver cancer a couple of times
Yeah.
over the years on Ultimate Health,
Yeah.
but it is so serious,
That's serious.
right? We had years back, we had a gentleman, handsome guy,
Yeah.
but we lost him,
Yeah.
right? So I would plead, it may not be next week, right? But let's have a date and talk about liver cancer,
That's fine.
right? And just another one I want to tuck in there before I go away. The lady with the fluid in the abdomen
Yeah.
and in the chest.
Yep.
This suggests progression.
Yes.
Okay.
Yeah.
You mentioned a deficiency in
Low albumin level.
albumin levels,
Yeah.
right?
Yeah.
Okay. Then you mentioned cirrhosis.
Yeah.
Okay. Please clarify for my listeners, because I know my listeners.
Yes.
Cirrhosis is not cancer.
Yes.
Is it?
So cirrhosis is not cancer.
Okay.
It just means that the inflammation has taken place over a long period of time and led to replacement of the normal liver cells with scar tissue.
Okay.
And this scar tissue does not function like the normal liver cells.
Okay.
And so all other things the liver was doing before may be affected,
Okay.
like the albumin production.
Right.
Yes. But
Okay.
cirrhosis can progress to cancer.
Okay. Right. And you can get cirrhosis also on account of alcohol.
Alcohol and the other causes we mentioned.
Other
Yeah.
damage, insults, and injury to your liver, a very
Exactly.
important organ. Well, on that, let me just thank you once again, Dr. Fatima Mohammed, gastroenterology fellow in training. When do you finish this training?
Probably in the next 2 years. Yeah.
Oh, can't we just give
Fast track it.
yeah. Once you've been on Ultimate Health, you pass. But once again, thank you so much. Thank you, my discerning listeners, and thank you, Ziggy, my producer, who takes pictures of me when I'm off guard, and they never look good. But my relatives say it's their face. It's from the family, so it's not Ziggy. Stick and stay on Joy 99.7 FM. Ultimate Health, as always, informative, transformative. Don't go anywhere. Ziggy is about to transform you with some good music.